Hi guys, welcome back to my channel. Welcome back to Blossom Women. Hope you are all well and doing great. So, my name is Anita and it's a pleasure to have you back on my channel today. So, today's video I am going to be sharing my own personal experience on when I got started with HRT and medications. So, on that note, let's get this video started. So, if you have not seen my previous video on how I was diagnosed with POI, definitely go watch that video because it ties in perfectly with this video. So what I'm going to do for you guys is I'll leave a link on the description box below. Click on the video, watch the video, and if the video if you can relate to the video, definitely leave a comment or send me a message, and let's just have a chat about POI and get to know each other better in terms of symptoms and things like that. So after being diagnosed with POI, I had to get started on my treatment straight away, which is HRT, hormone replacement therapy. HRT is also known as post-menopause hormone therapy or menopause hormone therapy. And HRT is a form of hormone replacement therapy used to treat symptoms associated with menopause, early menopause, premenopause, and there's so many names out there for it. Now, having done my own research and having met people that actually explained to me and educate me that HRT is the most effective treatment that is available to help relieve the symptoms of menopause and early menopause, such as night sweat, hot flash, mood swing, bladder symptoms, and so many more. So, and depending on the individual, for me personally, I've been on HRT since I was diagnosed 10 years ago, and it's a continuous medication for me. I have to remain on HRT until the actual age of menopause. Now, for even when I get to the actual age of menopause, for me to be able to be, for me to be taken off HRT, they will have to do a full examination again just to make sure it's ideal to be off HRT at that age. So it's a long process. I'm going to remain on HRT for a very long period of time again. So until menopause age. Now, again, it's different for everyone as well. Now, I do know as well that I'm sure you know as well that there are different forms of HRT. You have the patch, you have the gel, and then you have the tablet. So I have been on the patch previously, and I'm currently on the tablet. Now I don't know. I've never used the gel before, so I don't really know about the gel. If there's anyone out there who is actually has used the gel or you're currently on the gel, definitely let me know. Leave a comment below or send me a private message, because I do know people want to keep their privacy, and I completely understand that. So send me a message letting me know how is the gel like. What is the gel effective? Does it help? And what are the symptoms with the gel as well too? Because each individually experience HRT symptoms completely differently, because everyone's body is different. So definitely let me know, because I want to know. For me, because I've been on the patch and the tablet, I know what both symptoms are like for me on my body on both medication. So guys, what we're going to do right now then is I'm going to get into the medication aspect of things. I'm going to share all the medication I've been on with you guys, and what made me change from the Femistone dose I was on to a much higher dose. So let's get in. So I started with the patch. I started with this patch. So I'm going to put a picture up here. This is the patch that I started with, and it's a hormone replacement therapy patch. So the patch, I used to change the patch twice a week, and I know that depending on the individual, some people put the patch on different part of their body, but for me personally, I used to put the patch on my thighs, and the patch, I used to change the patch twice a week. So I would rotate between both thighs in putting the patch. I wouldn't put the patch in one thigh for like a week or a month or anything like that. I would rotate between. So I'll probably put in one thighs, I'll probably put the patch for like 2 to 3 days, and the next thighs I'll put the patch for the rest of the days. I was rotating in that aspect. So for me, being on the patch, I did not really like being on the patch at all because the side effect from the patch on my body was it was very severe, and also the fact that it was very inconvenient for me in terms of when it came to having a shower, rubbing cream or body lotion, because I also have dry skin as well. So you have to avoid anything harsh chemical around where you have your patch as well too. So I didn't like the patch at all, and the side effect from the patch was very severe in terms of breast tenderness and breast soreness as well too. Soreness. My breast was extremely sore. Like even just getting out of bed when I wasn't patching, getting out of bed was my boobs would be so sore and tender. I doing anything that involved physical exercise or anything that involved anything that's physical, my boobs was always, always, always sore as well. Public public space. I was very protective of my breast region in public space before. Even if someone just accidentally bump into you or you accidentally bump into something that involved your breast, I would scream, and you will hear my scream from Dublin all the way down to my mother's land, because that's how sore that's how sore the breast was. And eventually I was just like, no, I cannot take this anymore. So, and also one of the other side effects that I had was breakouts. I had major skin breakouts. My face was breaking out like crazy. I know some people get like redness and itchiness on their skin. I didn't really get much on my skin, but I did get ringworms. I got ringworms on my skin for a while, but mostly my face. I had major face breakouts. I had huge spots all over my face. And there were other side effects that I had as well too. But what I'll do for you guys especially is I'll create a video just on side effects on its own for you guys later on. So mainly because of the breast tenderness and other side effect that I had as well, I had to then express to my GP and say, look, I can no longer take this anymore. The side effects, especially the breast tenderness, and soreness, it's really bad on me and it's affecting my daily life. I couldn't do any physical exercise, anything that is involved. I could not do anything that involved any physical exercise. I had to be very protective in public. I had to be very careful where I am so that people don't bump into me or shove me a little bit, because it's just the pain. Getting out of bed was so painful. So I had to express my concern, like, okay, is there something that can be done? Can this medication be changed because the dose is too high for me? So they did their own research, and the GP recommended me to my gynecology, and then they went through the process of then prescribing me the Femestone. So I'm going to put a picture also of the first Femestone that I started on here. So I started on that Femestone 1x5, and instantly after a few months, because it does take a few months, but for me it was about 6 months for me to notice the difference in my body. So within that 6 months, I noticed a dramatic difference in terms of my breast tenderness. I still get sore breasts. I think it's just part of the whole process, but it was able to reduce the pain and the tenderness of the breast. So my boobs is not as sore as it used to be any longer. It's much better. And then my face breakouts, you can tell as well, it's much better right now. Right now, I'm having a bit of a breakout because I'm back on my thyroid medication, and I do get breakout when I'm on my thyroid medication as well too. So it's breaking out gradually, and I'm gonna guess, but right now it's still okay. It's not bad, but it's gonna get worse eventually as time goes on, as long as I'm on the medication, and eventually my body then adjusts to the medication and starts to kind of heal a little bit. So going back to the Femestone. So I started on the Femestone. So I was on the Femestone 1x5 for, I believe, 8 years to 9 years, because I changed the Femestone to a higher dose last year towards the end of 2019, because the medication became ineffective. So the reason why I noticed that the medication was no longer working was because my symptoms started coming back. I started to notice the symptoms. Now, bear in mind as well, I was going through thyroid as well at that period as well too. And thyroid has its own complete symptoms that because the symptoms were starting to increase them dramatically, and I noticed them. At first, I wasn't sure, so I did some research online. So I did some research online, and I found out that when your HRT medication becomes ineffective, that's when you notice your symptoms are starting to relapse. So what I did then is I found the higher dose, which is the 2x10 Femestone. So I'm going to show you guys a picture of that one. So let me get the medication. So give me a second. So this is the Femestone that I'm currently on. Can you guys see that? Let me show you. I hope that's clear. So you can see it's Femestone 2x10 mg. So it's the Femestone 2x10 mg. And if you look there closely, hope that's clear enough. So I've been on this now since I've been on this, like I said, towards the end of the year. So it's been about 6 months, going to 7 months actually. No, I think it's more than that, probably 8 months. It's been about 8 months since I've been on this. So, and having started that higher dose, my symptoms, it helped my symptoms a lot, to be honest with you. It really helped me a lot. So I think because I was on 1 mg, 1/5 milligram for 9 years, with no break, and it's just eventually it's just, I guess as you get older, your body changes. For me, I know your body changes, things happen, so it was just not working out for me anymore. The medication was no longer helping, so it was time to actually try a more higher dose, and the higher dose has been really, really good to me. So but what I'm waiting on is to hopefully see a specialist by the end of this year, and just to kind of do their own like examination as well, just to make sure that I'm on the right dose of medication that I'm supposed to be on, and it's helping me to the best that it can. So I'm waiting on that. Until then, I'm just gonna keep taking this medication here. With this new dose of medication, I've noticed that I've been getting regular periods on a monthly basis. So I'm definitely keeping a note on that from when I see my specialist, so I'm able to give them all the record. Because with the Femestone 1/5, I wasn't bleeding that much with that medication. My bleeding was probably, let's say, once a year or twice a year. And with the patch as well, it was the same thing as the Femestone, the first Femestone. I was not bleeding. My bleeding was not regular at all. But with this one, I've been bleeding on a monthly basis, even though it's been 8 months. Because I do understand that when you start a medication for the first 6 months, you actually will bleed for your body to get used to the medication. After that, the bleeding becomes irregular. But it's been 8 months now, and I'm still bleeding. So I'm bleeding on a monthly basis. My period comes, but on a monthly basis, and it's usually for 5 to 6 days. So I'm just gonna keep an eye on that and see how things are, and I'll definitely do an update later on to let you guys know about that. So with all this medication, the patch, the first Femestone, and this current Femestone, they all have a combination of estrogen and progestogen. So just in case I'm not pronouncing the progestogen right, I'm going to put it right here. So they both have estrogen and progestogen. So estrogens are hormones that are important for sexuality and reproductive development in a woman, such as breast development. And estrogen also plays a major role in your bone health, cognitive function, and many more. So estrogens is so much important. The fact that with POI, your body is not producing estrogen or functioning the way it's supposed to. So me being on HRT is actually providing those estrogen that my body is lacking, that my body is not producing in the natural way. And then when you then talk about the second part of it, of the medication, which is, so progestogens are hormones that protect the lining of the uterus if you still have your uterus. So for me personally, I still have my uterus, so that's why I have progestogen with my estrogen for my medication. Let's say, for example, then if I decided I want to have kids in the future and I want to carry my own child, I can choose using IVF, and so my uterus has to be protected in the long run from other conditions as well too. So that's why it's very important to have progestogen with your HRT medication. So you should definitely seek medical advice with your GP on that, or your gynecologist, just to make sure that if you still do have your uterus, that your medication has progestogen with it and your life. So guys, that is it for the HRT and my medication. So there's and one more medication I would like to share with you, which is I've been on this medication since the start of my HRT journey, so I'm going to share that with you guys right now, which is this. Let me try and zoom in to make sure you can see this then. So this is the 600 mg by 400 IU. So I've been on this since the start of my HRT journey, and I take this twice a day, in the morning and in the evening. And I take it with a full glass of water, and I also incorporate foods that are rich in calcium as well to my diet. And yeah, so this calcium is very important for you, and you need to make sure that your calcium that you're taking also has vitamin D, because your body requires vitamin D for it to be able to absorb the calcium into your system. So guys, that is my story on starting on HRT and medications. I just wanted to share with you today. And if you want to share your own journey with me on being on HRT so far, your side effects, how you're feeling, because so guys, that concludes today's video. So just make sure that you speak to your GP to make sure your gynecology, to make sure that you are on the right calcium supplement, and make sure that you are incorporating food that are rich in calcium into your lifestyle, your diet, because it's so essential for us to look after ourselves, our body, our soul, our mind. And